Welcome to Pivotal People. Today's interview is with Clare Auty, who is the Head of Independent Health and Social Care at Browne Jacobson. Thank you very much for joining us today here in London. We're hoping to get out of you a little bit more about the interesting journey into where you are now. Tell me a little bit about where you started and what got you into being a solicitor. What made you want to be a solicitor in the first place?
I don't really know. I'm one of these strange people that I've wanted to be a solicitor since I was 11.
Yeah.
And I don't know why I wanted to be a solicitor, other than when I was walking to school, I walked past the law college every day, and I loved witness for the prosecution. But so from 11, I said I wanted to be a lawyer.
Did you understand what that meant at that point?
I think at that point I was more, it was about the criminal justice system, and it was about justice, and I knew I was good at arguing, and I knew I was good at English, and it was something that I thought I was suited to. Yeah. And then as it progressed and my interest progressed, by the time I was 16 I wanted to be a business lawyer. And I wanted to work in-house, which is sort of not many people have that sort of clarity. So I always wanted to be a lawyer, and I'm incredibly fortunate that I got to do what I wanted to do, and I still enjoy doing it now, sort of 30 years on. So
take me back to your time you went to university?
Yeah, so I went to university, and I was lucky. I was sponsored through university by what was then ICI, and that split and became AstraZeneca. So I did work placements during university where they were developing drugs and working jointly with cancer research. And so I got a love then of healthcare and an interest then of healthcare. And I'd always, two of my friends, their mothers both died when I was at school from cancer. So I'd always fundraised for cancer research. So I'd always had this sort of interest in healthcare and charities and doing that, and thought I would finish my career working for a charity. That was always the aim, work towards that, and then, when I was in a more secure position, go and work for a charity. And then I had the opportunity, when I had my first son, to go and be General Counsel at St Andrew's Healthcare. So I'd worked in-house. I've spent 16 years working in-house, firstly for a tech company and doing patient administration systems, imaging systems, health tech systems, and then had 5 years in brewing, and then I moved to St Andrews as their GC. So I got to work in healthcare and work for a charity far earlier in my career than I thought.
Fantastic. And working for St Andrews, did that give you an insight into what goes on on the floor, really, of the healthcare sector?
It did. Yeah. St Andrews always had a policy, and particularly I worked 𝗜ጵ𝘁𝗶𝗵𝗄 as the CEO when I was there, that you had to understand what we did. You had to go back to the floor. Christmas Eve would be working on the wards. We have a rota for Christmas Day. I always spent New Year's Eve working with the women's unit up in Birmingham. So we'd go and paint nails and get ready for New Year's Eve. So you had that interaction with patients. You weren't sat in an ivory tower. And it was really good. It made the job more worthwhile. If you were having a bad day going through the papers, you could go out and do an activity with the service users and see it. But then you saw the challenges as well. Yeah. And when I had my second child when I was at St Andrews, and when I came back off maternity leave, I trained as a healthcare assistant and did some shifts as a healthcare assistant before going back to the day job, which gave me a real insight.
Yeah, I think that's something that we've found. Doing these interviews, we've found a lot of people like yourself that actually really understand what we do on the ground, that actually understand what my background is care homes, but you've got a very similar, working as a HCA in a hospital. Yeah, okay. So I think what we found during these interviews is that the people like yourself that feel, you're working on the periphery, it seems, but you're actually not. You've been there. You've actually been on the wards. You've done the caring for people. And I think that's what makes this very special, because I don't think people out there understand that you have really done the job, the basic job. So tell me a little bit about working on the wards and how that was.
Very difficult. It's hard work. But it also, so I was responsible, as well as legal, I was responsible for HR. And it was seeing what the staff on the ward went through when they were trying to get temporary staff on, if they were short-staffed and somebody had phoned in, phoning through the line that we'd set up to get the bank staff, and the amount of time they were in the office and not with the service users trying to get through. So then it was going back and saying, okay, we need to put a dedicated line in for the wards so that they're not coming through on the same line that the staff are phoning to book their shifts, and let's try and make things simpler and easier. And then also seeing night shifts, and working a night shift is very different to a day shift. And the challenges that has. Working on the wards, it's incredibly hot. It was a heat wave, and just seeing, the staff, and their priority was always the service users. It was always the patients, and putting them first. And I can remember being on one ward and we had a patient moving from the women's unit and stepping down, moving to a different ward, and that nervousness of her coming onto the ward and just wanting somebody just to sit with her. And just make her feel comfortable on her first day moving. And I think particularly in secure mental health, it's a really challenging world to work in.
Yeah, and I think for somebody working in HR, it is really valuable to know, how they're feeling. We do, staff welfare is really important within the care industry, and that's something that at the moment we are struggling to get staff. We lost a lot of staff during COVID.
Yeah.
How do you see the future of staff in our industry?
I think it's really challenging, and it's every time I talk to clients and to provider clients, the number one issue, the number one challenge is staffing. Yeah. So how do you retain your staff? And we've got an ageing workforce. They're getting older. So we've not just got an ageing population that we've got to care for, we've also got an ageing workforce. Yeah. And I know when I'm doing due diligence on transactions, I always look at the age makeup of the workforce to identify whether they're going to have an issue going forward. I think with the problems that we've got with the visa process, having a different standard for social care to what you've got with the NHS, making it more difficult to bring people in, not being able to bring in family members is going to make that even harder when that's plugged the gap for so many people. And we're seeing the whole system slowing down at the moment because so many people are trying to get in before the deadline and trying to get people processed, and it's just slowing down. I think working with people, it's a vocation, and it is a true vocation, but you often don't know that until you're working in the sector. And we would always do a lot of recruitment where if there'd been redundancies locally, sort of in manufacturing or in retail, and go in and try and persuade people to try a different career and a career in care. But it has to be rewarded properly, which is hard to do when you're under so much pressure on pricing and local authorities are cutting back. But I think, so the start of it for me, for the staffing, has got to be making it a vocation, making it valued, doing training at school level to get young people interested in a career and in a vocation in care, making them understand that there is a career path, you can be promoted, you can get to being a care home manager, and it is a rewarding and valued career. And I think we don't always get that message right, and we're not getting that message right at a young age. We're not showing that it's valued at the moment. And I think the difference in pay between social care and the NHS doesn't help.
Yeah, I agree totally. I think the biggest issue at the moment that we're seeing is nurses.
Yeah.
We seem to have we're not using so much agency with care staff across the sector, but we are for nurses, and again the visa issue is quite a problem. Okay, so you then moved on in your career. What took you to the next step from St Andrews?
I think at that stage, I'd been in-house for 16 years. I'd only had 2 years as a qualified solicitor in private practice before I moved in-house. And it felt like unfinished business. And I remember the head of corporate saying, when I handed in my notice, and saying, you'll be bored and you'll be back. And then I went back into private practice because it was unfinished business. And she messaged me and said, I told you you'd be back. So 16 years later. But so part of it was, for me, and at the stage I was at, I'd been at GC level for a number of years. I wanted to stay in health and social care. There aren't that many senior GC positions in the UK for people of my level. So to stay in health and social care, it had to be going into private practice, and I wanted to go to a firm that was already had an established health and social care practice, but would also let me do corporate and commercial, because that's what I'd done as a GC. And I was really lucky with Browne Jacobson, and they let me be a GC whilst being in private practice. So for my clients, I don't just do the corporate, I often do the commercial as well. I am that sounding board, I am that sort of trusted advisor. So it's far broader, and I'll get calls saying, what do I do about a noise abatement, and what do I do about transporting patients, and is it okay if my staff drive patients in their own car? And strange queries that come up when you're a GC in-house, but you're not necessarily used to dealing with in private practice. But
yeah, really interesting role, I'm sure. And it feels like you've steered yourself into where you need to be, which is fantastic.
So, and I've got great clients, and it's when you build up that relationship with clients, and they just say, do what you do when you were in-house. So, and you really work with them, that works really well. Yeah.
So what's the future of you? What are you looking towards the future? What's your dream? What's your dream of the future?
Carrying on doing what I'm doing, building up the practice at Browne Jacobson, building up the independent healthcare practice and the life sciences practice. I've sort of gone back to doing a lot, which is where I suppose I came from all those years ago, doing drug discovery and doing life sciences. But I love the social care. I love the people in social care, and it's all about the staff. And being able to try and influence that, even though I'm on the periphery, is really, it's rewarding, and I enjoy doing it. I've just got to remember to do the day job and do the chargeable work as well.
Of course, yes, of course.
So it's difficult to recruit into what we do, because we can get a commercial lawyer, we can get a corporate lawyer, but as a team, we've all got to be passionate about health and social care, and it's having that passion. And so a lot of my team have been in-house. You know, some of my team have their second career lawyers, so they've worked in the sector in different roles, and so having people that are all passionate about it, it's great as a team. We've all got, I always say that we're a group of misfits, because we've all got different skills. One will be a procurement specialist, one will be a competition law specialist, you know, one does NHS reorganisations, but we're all passionate about the same thing. So, and that really, we understand the clients, and that helps.
Yeah, I think having that group of people that have lots of different talents and background knowledge is really useful in your industry. Okay, so just one more question. Okay, so take yourself back right to the beginning, 18 at university maybe, and what would you tell that 18-year-old? What advice would you give her for a career?
Maybe don't go to university.
Okay.
I was having this conversation with my junior lawyers the other day about the amount of debt that they've got and the cost of that debt, and how long it takes to get into law and to get the training contract, and you know. And then at the same time, I've got an apprentice solicitor who joined me at 19. She's done 7 years now. She's moved around the firm. So in our healthcare teams, I wanted a specialist healthcare lawyer. So she's been in our healthcare property team. She's been in our healthcare banking team. She's been in our claims team, and she's done patient recalls on secondment for a client. She's been on secondment to NHS England, and now she's coming up, she'll be fully qualified, having spent the whole time with us and done her training contract with us and her degree, and will be a qualified solicitor but a fully rounded lawyer without any debt.
With no debt. That's fantastic, and that's a good thing to think about for anybody that's listening, I'm sure.
So, and seeing her confidence and seeing how she's grown, you know, I still think of her as being 19 and she's 26 now, and you know, and she's absolutely brilliant.
Yeah, I wonder how many people that know that route's available, and that is something that they could follow, but university seems to be the way that people want to go.
When you're a solicitor apprentice, because it's so much longer, you sign a 7-year contract. So it means that each seat can be a year long instead of being 6 months long. So you really get to know an area and understand, is that what you want to do?
Yeah, that sounds really interesting. Thank you for that. Thank you. Been really interesting to talk to you, Claire.
Thank you.
And thanks for joining us.